Hi, my name is David Szabo. I work for a startup called Tresorit, and we have been in the news last week with Apple's health group. We built end-to-end encryption for Apple's CareKit, which is Apple's open source framework for building mobile applications in healthcare. Why did we choose to work with Apple? So here's my take. Beyond Apple's grand vision of Health 2.0, Apple is really well positioned to disrupt healthcare with their developer ecosystem, their awesome devices, and this whole love in the air about the Apple brand and all the user experience and awesomeness that they have built over many years. But what's even more interesting about Apple is if Apple manages to land their Health 2.0 vision, it's definitely not going to be a more efficient and optimized version of Health 1.0, the healthcare that we live in today. It's going to be something vastly different, with the patient in the middle, with lots of data and awesome devices. So that's why we work with Apple. Let me share you a story. It's actually a true story within my social network. There's this young woman in her 20s. And one day she got this virus infection, which puts her into coma for 3 months. 3 months later, she wakes up and she forgets to walk. She forgot to walk, she forgot to speak, she forgot to write. Thankfully, she could still read a bit. So after the hospital managed to stabilize her conditions and discharged her, this is what they told, the doctors told her. You know what? Your best strategy is to take 2 years off now. Go home, let your brain to recover. Take it easy. Your brain will do it. So she tried it for a bit. She went home, and after she got bored, and then she started to use her iPhone after a bit, and she downloaded this app called Lumosity. Do you guys know Lumosity? So Lumosity is training for your brain through mobile apps. So she kept playing with Lumosity with all these improving apps, and then she kept downloading other apps and more apps. And the next thing she remembers is she is applying for her master's degree to go back to school. She finished her master's degree, now she's in her PsyD degree as a doctor for psychology, and she's one of the top students in class. Imagine if at the other end of the Lumosity app, there would be the hospital. Imagine if the hospital could track her progress, challenge her or take away challenges from her, and really monitor her condition of how her brain develops and how her brain recovers. And imagine the other patients who have been diagnosed with the same problem, with the same virus, who went home and accepted the doctor's advice to stay home for 2 years. And then imagine all the other conditions where technology can make such a difference than to this one. So Health 2.0 is about our data and our devices, with us in the middle. And today's technology is already enabling that. We are already using our watches and mobile phones, and we have so much data collected about us. And I've seen many startups here doing insulin pumps and devices that can diagnose and take data in and use it in healthcare for this real simple workflow that I explained about her. She did it herself. So it's all about data, but as security stands today, Health 2.0 is going to be a little shaky. So if you think about all the data breaches that we read week by week, security is broken. The first thing that really breaks, and the first thing that we can call out that causes most of the data breaches is user authentication today. So user authentication is the feature that app developers use to register and log in patients and users. So almost with no exception, most user authentication services today use hashes to protect passwords. And hashes can be breached relatively easily. That's why you read in the news every single week of how many millions of patients or user passwords have been leaked. So the first thing we did was user authentication, and we built a user authentication service which is not using hashes. We use a protocol built by Stanford about 25 years ago. It's called SRP, and we can provide to mobile app developers a service that doesn't store passwords. We actually are not aware. We don't know the passwords. Therefore, we can breach it out. So that's about user authentication. And the second part of protecting Health 2.0 data is once you fix your user authentication and once your patients and doctors can log in securely, you can now start to encrypt data. And so we built an end-to-end encryption SDK or service. End-to-end encryption has been around for at least 2 years. And if you and I chat today, we'd probably use end-to-end encryption on our iPhones or WhatsApps. So end-to-end encryption has been around in a form of chat applications, but now we made it available for healthcare app developers through CareKit and through other platforms. So from now, you can encrypt, end-to-end encrypt patient data and health records. How awesome is that? We are very proud that we have early customers. Actually, one of our customers is here, CareKit, the living address book. Thank you for coming. So we are very proud to our early customers, and we have more and more signing up. We had about 2 million reads from the Apple CareKit campaign last week, but we need more. So I'd like to ask you guys to join us in our mission. Use our authentication service. Don't rely on hash-based authentication. You can sign up here to our website. Use our end-to-end encryption to make Health 2.0 a secure way. And we are a startup and looking for funding. So if you're an investor and if you like our stuff, please join us in our mission. Let's talk. Thank you.
Thank you, David. And congrats on all the success. Folks, do you guys have a question? David? Okay. What's next for you guys? I saw the announcement with you guys and Apple Health. Could you talk more about that relationship?
Yes. So right now, we want to work with the healthcare companies and the startups that came in through Apple. And we want to make sure that we make an impact there. Instead of bragging about what else we do, we want to make sure that we land what we got and we drive that vision home with companies like Care and healthcare companies. That's what's next. We have a grand vision for what's coming next in terms of technology and roadmap, but we want to make sure that we make an impact first.
And so what are you guys kind of like improving in the current Apple offering for the app developers? Like what's the benefit now with you guys kind of in the picture?
So Apple has always been famous about its security, and Apple builds all devices and applications with security in its core. What we do is once you go beyond one device and into the cloud, that is outside of Apple's remit. And that's what we do. We enable CareKit and healthcare applications to go beyond the Apple device security into the cloud across devices and across platforms. So cloud security is what we do, and end-to-end encryption.
Well, anybody else questions? Oh, we got a couple. There you go.
I'm just curious, if security is really a problem across the board, why do you only work with healthcare customers and not anybody else?
Why do we work with healthcare?
Healthcare providers, customers, not any other kind of customers.
So if you look at the landscape of 2016 and how many VC-funded startups born out from the healthcare ecosystem, there's over 200, over $12 billion went into healthcare. If I can make a bet of which group is going to make more millions of patients to use devices in healthcare, is it the healthcare providers today or all these new funded startups with the $12 billion? Who is going to make users jump onto their iPhones? It's probably the latter. So that's why we believe that small applications are the disruptors and small startups are the disruptors, and they are the ones who need encryption and authentication and security. Healthcare providers are coming next, and I hope that these young startups who got funded last year, they will join the healthcare providers and use their impact to reach more patients. But I think they'll start off as independent healthcare startups first, and if they don't think security on the first day, they're doomed to data breaches and all that stuff.
Okay. Congratulations for your talk. Nice talk.
Thank you.
And we are working on an initiative in Brazil called Open Health, where we are trying to convince the people to share the data and publish the data, because I think that we are losing all the data that we measure about our blood pressure and things like that. And how do you see that? Because you work with security and you are taking care about all these things that is privacy, because beyond security we have privacy. what Apple will do with our data is something that scares me more than someone cracking my password. And what do you think about opening data from a healthcare system and collaborating and integrating and doing things like that?
So thank you for the question. So what we like about end-to-end encryption and this whole new world of cryptography that is on us is you don't trust anybody anymore. You trust mathematics because cryptography is all about mathematics. So with end-to-end encryption, your data is not exposed to anybody besides who has the keys to that data. So that's the beauty of it. Once somebody wants to use data for research, there are solutions of de-identifying data or encrypting parts of the data that is personal, and we have examples for that as well. So both works. Thank you.
All right. Thank you so much, David.